Hi, Katie. Hi, everyone. My name is Lauren Tancredi. I'm the practice development lead here at Hint Health. I help run the DPC Accelerator. And what we've heard from you in the past is that you love coming to the Hint Summit, that you want to walk out of here with some tangible items that you can actually put into action in your practice. So Ariele, and I'll let you introduce yourself.
My name is Ariele. I'm the Senior Product Marketing Manager at Hint. And I'm also one of the people behind DPC Accelerator, which is a free business training course for Hint clients. So it's got a lot of fundamentals about how to run a DPC practice business-wise.
And so we're going to give you a little taste today of what it's like to participate in those courses, but hopefully that you feel inspired to move to action after hearing Paul Tom's talk today, and you feel a little bit motivated to share your why with your community, maybe do some outreach through social media, and really bring together your character and communication to create your brand. I think you did a really great job in setting us up for this workshop. And today what we're going to do with you is go through the agenda first. The first thing is that we want you to always be collecting, whether or not that's connecting with people through social channels or taking their emails in. You want to be able to build your pool of leads and prospective clients to teach them about who you are and share your voice with them. And before
emails are so important
because
that's how you continue a conversation in a way that feels really personal. So before we start talking about email marketing, we're going to jump into a poll. If you guys can see that polls tab, and let me know, what marketing tool do you use to send emails? Like a newsletter, it can be Gmail if you don't have a fancy tool. We really want to know what people are using. And that's going to be really important as you build out an email marketing campaign, because that way you'll be able to automate so much of the work that goes into communicating with your members and prospective members.
ActiveCampaign, Infusionsoft, awesome. These are all great communication tools for you to put together your email marketing campaign, which we're going to go through the elements of a great email marketing message.
So a great email marketing message is one that gets to the point and has a very coherent action. So in this diagram here, you can see that the key elements are a great subject line people want to open, some sort of theme for the message. It's got to be about something, right? Even though the goal is really just to get them to enroll. An image that supports that theme to just draw the eye visually. And then the benefits of enrolling in your practice. This is something that you should really hone before you start doing an email marketing campaign. These benefits really shouldn't change from email to email. And then you have your big call to action button. It's called a CTA in marketing speak. And lastly, a warm sign off to make them feel very personal. I saw someone asking if these templates are available after the summit. Yes, and they are available right now too. So just click that link in the chat. It's going to be up forever. So you can always refer to that link, and I'll send it out in an email too. Now we want to kind of get into getting you guys to do some of the work of building an email campaign. So what we've done is we've just broken down a 5 email campaign for someone who's interested in your practice, but they haven't enrolled yet. When you get their email address, the first thing they should learn about is why. Starting with why is a really time-tested principle of defining your vision and of connecting with potential members. So the first email should talk about your why. That's day 0. So you can notice I have a little timeline on the top. This is to help you set this up in your actual automation tool. Day 3, introduce the clinician. Maybe you have just one clinician, maybe you have multiple, but just choose one to give a very personal touch. Day 9, which is the third email, do a patient story. And when you do a patient story, obviously you need consent from a patient, or you could do an anonymized patient story. But this is a really good way to help potential patients connect with the outcomes that a different patient has received. The 4th email is explaining the difference between fee-for-service and DPC. I think a lot of times this is our first inclination to just jump right into explaining the difference, but that's not really the best way to start connecting with someone. So it's good to include that more on like the 4th email touch. And the final one is to put a little bit of pressure on them. Say you have a decision to make about your health and really put them in the driver's seat. So with that, we're now going to actually put you guys to work. If you have not already opened the worksheet, please do. And please also open a blank document. In that worksheet, we have 5 sample emails that we've written from the perspective of a hypothetical DPC. And what I really want to see you guys do is start sketching out each of these 5 emails. Start with whichever one feels the most comfortable and easy for you to do, even though this is the proper order of them when you actually send them. So we're going to just be here, and we'd actually love for you to start typing some things down and copying them and pasting them in the chat. If you'd like some feedback.
Amazing. Again, we want you to use what you've learned from the morning and yesterday's sessions to really move into action around your practice. And if you can remember back to Paul's talk that just happened less than 30 minutes ago, in the first 2 slides, he lets you know what he believes in as a practitioner and what has allowed him to continue to convey his story. So he started with his why right out the gate, just like we're asking you to do with your patients. And so that why was around delivering care that's affordable and accessible for people, right? And so what you're doing here is really getting to connect with your patients' perspective and current, and to believe what you believe in, right? And so that you are attracting the individuals that you really want to work with and care for in the future.
Oh, good question from Dr. Tanya. Would you do something different for pediatric practices? Yes, your target for your pediatric practices is the parent. So connecting with the parent on why you chose to open a pediatric DPC practice might look a little bit different than connecting with a potential patient about why you chose to. It's not materially different in terms of the structure, but the patient story as well, you're obviously speaking to someone who's thinking about someone else. So that's kind of the only difference, I think. Katie just had a really good point, which is this could be this structure could be easily converted to members who are already enrolled and getting them to engage. That's such a good point. Lauren, do you want to talk about why patient retention is so important?
Yeah, absolutely. I think that, Katie, in that perspective, like somebody else is paying for your benefits package. And so now you get them to actually move into adoption. And so there's an educational and nurturing element around this that actually needs to be conveyed. And this is the same kind of sequence that we've set up here. It's like, all right, first let's get you familiar with like what it is I believe in, and then who I am. So it's speaking to that character side of things, plus, who's using the practice and the outcomes that they're getting. And so I think that that's a really good point, and you can easily shift this into part of your, like what I call the employer toolkit, which they can actually help deploy out to as a large employer to their employees to get them engaged and enrolled and activated within the practice.
That's such a good point. So we have a couple questions and a couple just like clarifications. Brad Ferris, he is also a marketer extraordinaire. He says to reinforce the importance of a great subject line that grabs attention. So here I am going to reinforce it right now. It's so important that you write something that makes people curious, makes people excited, and want to click. Think about what you like to open. Dr. Rasul Montessori asked, what is the target population? That's actually something that is work that must be done before we start writing these emails. That will go really hand in hand with what your vision is and what the value proposition you have. So if you don't know yet who your ideal patient is, then you should do some work to understand that. And we actually have a really great lesson in DPC Accelerator about defining your target patient. And we can't really tell you what that is.
Yeah, and if you don't have a clear idea right now, it's like you get to look at who's in your patient base like currently, and like who do you want to work with, and so that it will start to like draw out similarities around character and interest, so you can start to really define that there. But you'll know who's coming into your practice, how they're getting there. And like Ariele said, like if you're a hint customer, come into the accelerator. We've got some workshops that can help you further define who your target
As an
market
example,
is.
One physician was saying that she deals with a lot of immunology. And so she has a lot of women who are her target audience. So then everything that has to do with marketing, she targets it towards where that target audience is. As well as the messaging. We have a great, Jamie Glover just put in their why: to provide personalized relationship-based care, not impersonal assembly line care. Lauren, I'd love to hear your thoughts on that as a why.
I love that the start of providing personalized relationship-based care. And I think that I would try and refrain from what you're not doing so that you're focusing on the positive, right? So we want to move people towards outcomes. And sometimes when we think about what we're not doing, it gets us going down the rabbit hole. I think that there's a place for that as you go into further explanation, but that's a really great start. And what I like to think too is like, there's a saying that's like, you want to give them a why that makes them cry. So sometimes you got to go even deeper. Okay, why am I providing personalized care? Like, what's the layer beneath the layer? What are the things that I'm not actually speaking?
That's a good point. Heather Nielsen asked, their mailing list includes their DPC members. Should she create a different list that takes them out or send this kind of marketing to both current and prospective? Okay, so you definitely should make a list that is specifically for prospective members. Engaging with your existing members is awesome and totally encouraged, but this specific email campaign is really designed to grow your practice. And so for that, it's a different type of message because these people don't really know you quite as well, and they haven't put any skin in the game by paying for you. So that's a quick answer to your first question. The other one,
our thought, I'm going to just piggyback on that, is our thought is you just got on TV because Paul Thomas set you up, right? And now all these leads are coming in. And so this is the sequence you get to educate these prospective patients on. So ideally there's like an automated tool here that's getting you set up to help support your sales
exactly.
process.
The next question is, you'd like to know more about the meet and greet with the MD. Great question. So our primary CTA should always be the thing we pretty much want most. And what we really want them to do is enroll. But there is such a thing as a secondary CTA. This CTA being call to action. Sorry, my marketing was turned on. So a secondary CTA is great for those people who are still in what we call the consideration phase. They haven't quite gotten all the information they need to be committed and convinced that you're the right solution for them. So we want to give them an option that will move them down the line, move them down the funnel to clicking that enroll now button. So a meet and greet is a way that some practices move those people down the line. Now, this isn't required. That's why in the worksheet, you'll see it's optional because it can take up a lot of time if you get a lot of people requesting meet and greets and you're obviously not getting paid for them. But it's a way for a potential member to call the office, schedule 20 minutes with you, and just you talk to them about why you're doing this, what they can expect as a member, what are the benefits, and just kind of really hone in on what the member experience will be like for them. And that's a way to give them that information in a little bit more of what we call a white glove way, hand holding them down that funnel. The marketing campaign is actually another way to bring people down that funnel. Like, it's 5 messages that progressively give them more information. But not everyone is ready to enroll just from a marketing campaign. And this will totally depend on how they even found you. Like, if they met you at an event, they might be way further down the funnel. But if they just saw you, clicked on an ad, they don't know you at all. So it might take a little bit more.
I see some really great whys coming in. And so just great health is our birthright. Like, heck yes, it is our birthright. Everybody should have access to that. We will redefine the experience of primary care and transfer healthcare to work better for everyone. Ooh, I love these. They're like getting juicier as they keep coming in. And so continue to like work and refine your why and get people to believe what you believe. Ultimately, that's how they end up in your pipe anyways, is that you've said something that's resonated with them. You've shown your authentic self to them and they're like, ooh, I could actually work with that person. And as Ariele said, like, the meet and greet might just be the final investment, because here's the reality. Not everybody's used to consuming retail-based care, and they might need to connect with their doctor before they're ready to put their money on the table.
So true. I saw a question about email going to spam folders and that being an issue. There are some email tools online, and I'm not like a digital marketer by trade, so I can't just rattle them off to you. Maybe someone in the comments knows, but where you can basically like check and see if you have everything set up properly in your basically in your email marketing tool. I'm so sorry, I wish I knew, but I just know this tool exists, so that's why I want to put that information out there, Dr. Bree. And another question was, so you mentioned that you aren't doing the meet and greets anymore. I think that's totally fine. I mean, you're not expected to be available to people who aren't members.
Yeah, absolutely. And then I saw a question around how do you get your email list to grow so you can have access to the patients and get the funnel into their email? Like, so you use tactics like Paul, and you put CTAs on your website and in your social media, and you continue to talk about your message out into the world so that you have a place to capture them on the other side. And so if you're a HIT client and you're part of the DPC Accelerator, both Ariele and I go into this a little bit more robustly, where we talk about the automation tools, how to set this up, and then what that looks like in terms of how do you implement it into all these various channels to actually start capturing some of that data, potentially with a double opt-in so that you're compliant with the email guidelines. I know somebody had a question about that too.
I saw it from on Meta that your personality can sell you with the meet and greets, but the time is a factor, and that you said sending emails back and forth with pricing and explanations in black and white has not worked as well. Okay, so here's what I would recommend. Don't explain like that. Oftentimes we get a little wrapped up in how, and we're not really focusing on the why or on the benefits of our patient. So you'll notice in that sample email that we wrote, we have 6 benefits written out, boom, 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 boom. And they're always drawing their eye to those benefits. We're not going into detail explaining how that all works. And that just helps the patient or the potential patient make a better decision about if it's the right place for them.
And like Paul just said, people don't buy what you do, they buy why you do it. And so it's all up to you. And this is why we've created this sequence specifically like this. It's like, all I'm doing is, here's what I'm doing. Do you believe me? Yes. Here's why I'm doing it. Do you believe me? Yes. And the more you can get them to say why and actually commit to the values that you're bringing forth as a practitioner, when it comes to the money, it's like a yes, right? In that, because it's been yes, 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 I believe this, I'm in it. And then the money's not an obstacle for you. So I would suggest taking that out of the equation and really just focus on like speaking from your heart, showing your authentic self, and putting forward what you're up to.
I'm going to answer one more question, and then we're going to jump into our CTA of the day. So Lori said, are you suggesting we put off talking pricing for a while in the conversation? I would say putting it off is not really the issue. It's more like focusing on the benefits. If they ask, you can obviously tell them, and that might actually be an indication that they're ready to make their decision. So that enroll now button, you know, the cat's out of the bag as soon as they click that as far as how much it costs. So it just shouldn't be the focus of the conversation. We want you to join DPC Accelerator for more pragmatic lessons on how to grow your patient panel. This is a free business training for HIT clients only, and you will see Lauren's face in there quite a lot. Each lesson is a video. Sometimes it's a little difficult to find time in the week to actually watch them and do the work, but I promise you they'll all be as useful as this one, because right now, if you did all the work that we talked about, you have a Word document with some ideas jotted down for an email campaign.
And if you can commit 15 to 20 minutes on your business a week, I promise that will help take you somewhere. That's all it takes, and we're here to support you along the way. We hope to see you in the Accelerator.
Absolutely. Thanks everyone for attending our session.